Dental implants are well, they're an option. They're generally the best option because it replaces one individual teeth. You're not codependent on any other teeth. You don't have to drill down any other teeth that may be healthy. So in order to do a bridge or to restore somebody without a dental implant, you have to sometimes drill healthy teeth that have never been touched, and that kind of opens up a can of worms for the future. That, you know, if the crown doesn't fit well, if something doesn't work out, you know, now you're kind of sacrificing an adjacent tooth, and when you lose one of those teeth from the bridge, the whole bridge kind of goes away. Dental implants, they're phenomenal because, one, they're independent of everything else, and they're very good and solid, and they replace a lot of the missing force that a patient can place on, say, a bridge, or if you can't place a bridge due to where the position of the tooth used to be. So it's a good option for restoration of individual teeth or multiple teeth, or in some cases, you know, to help a patient not have something flop around in the mind. For example, lower denture, if you put it in, sometimes it kind of sits, and, you know, every time the patient speaks, you think that it's about to fall out. It's going to boomerang around the room and come back in. So what dental implants do is they kind of remove a lot of that guesswork and a lot of those things that patients were, well, I lost all my teeth, I guess this is what I can only have. That's the other thing about this practice. It's not just this is it, this is all you have, and it is what it is. You know, there's options and opportunities, especially with dental implants now. You can have things that people weren't able to get before, and with the new technologies that are coming out and the new knowledge and research, you know, you can, again, 3 or 4 implants, 5 implants, and you have a full mouth, full arch, you know, lower dentition where you can actually bite into a steak as opposed to just look at a steak and maybe lick it on the way up. In order to place an implant, you need height and width of bone. It's kind of like, you know, you need the dimensions to place something. It's a one way, kind of like placing a screw somewhere. You need somewhere to screw it in. With 3D technology, you eliminate a lot of the guesswork, so you don't have to expose of as much of the areas. You minimize some of the surgical sites. You minimize the post-surgical recovery, and also it gives you the opportunity to kind of see where and how you can place those implants, because sometimes without the 3D planning, you know, you may be in for a surprise, and it's not always a pleasant one. So the 3D doesn't eliminate a lot of the surgical art and a lot of the prosthetic artwork that comes into restorations afterwards, but it does eliminate, it minimizes a lot of the guesswork, which is important. You know, you don't want to go in there and promise the patient one thing and then, you know, be unpleasantly surprised.